everybody, and welcome. We're excited that you're here joining us this evening for the webinar. It's provided by Vande Wellness, and we have this most excellent speaker and highly experienced Ayurvedic physician, Dr. Shashirekha. The focus topic for tonight is how to manage chronic pain through an Ayurvedic approach. So I'm Chrissy Shaver. I'm a wellness coach at Vande Wellness, and I will also be your moderator for the webinar this evening. To start, we'll hear from Dr. Shashi about the topic of chronic pain, and then we're going to allow some time for you to ask your specific questions. So during the Q&A session, you can type your questions in the chat box, or you can raise your hand and I can unmute you so you can speak your question to Dr. Shashirekha. But first, let me go ahead and introduce Dr. Shashirekha. She is the head of the Department of Preventative Medicine and Yoga at Dhanvantri Ayurvedic Medical College in India. Additionally, she has authored several books, one titled Yoga Body Anatomy, and you can find that on Amazon. Her upcoming books include Ayurveda Wellness and Yoga Injuries. Dr. Shashirekha specializes in treating muscle, bone, and joint-related injuries with individualized yoga practices. Over the past 15 years, she's been committed to providing authentic, safe, and quality care and therapies, helping people live a holistic life through diet and lifestyle balance. She provides nutrition and exercise programs tailored to the individual's body constitution and offers solutions based on the ancient wisdom of Ayurveda. So here you go, Dr. Shashi, welcome.
Thank you, Chrissy. Thanks for the introduction. Well, before we start, I would like to welcome all the guests in the webinar. And I do want to congratulate before beginning to having taken a step ahead to educate yourself about the condition you're suffering from or the very condition you have been seeing in your closed ones, loved ones. So definitely educating yourself in this particular topic is going to be very much helpful as a lifestyle changeover. And more you get educated, you're much better managing yourself. So on that note, to start with the very topic, we'll go to understand first what is this particular type of pain, what we are talking about, and what are the symptoms through which you can know that I'm suffering from chronic, or it is just an acute, a negligible pain, a good pain, bad pain related description. Followed after, we'll get to know about some of the conditions which get associated with the presentation of chronic pain and how do you need to get to evaluate yourself, seek the help in the beginning days itself so that you can be very much able to address the condition. Followed after, we'll talk about the Ayurveda approach, the holistic way, how we can better the very conditioning, improvement of mobility, as well as start to have a pain-free life. So I'll introduce you to some of the modalities of the life science called Ayurveda, which is going to be pretty unique and be executed at your convenience, most of it at your convenience only, and better using the substitutes like nutrient supplements from your kitchen, from the known herbs. So on that note, let's start to know what is this chronic pain. Pain, as you know, we all have gone through one or the other time in your life. And a pain can be dull aching, to a throbbing pain, or sometimes it looks like piercing pain, squeezing pain, or it could be something like a neurological pain getting to be repeated often. And the signal coming from your brain is an indication of something wrong beneath onto that side. So it can be as a simple injury like a cut wound or a muscle pull, or it could be a condition like back pain, anywhere in the back. It could be upper back, lower back, or it could be in the joint area specific. So whenever this pain starts to be picking up your notice and it's not really going away, even after about a couple of weeks to a couple of months, then we define it as chronic pain. Typically, any pain which is more than 3 to 6 months old, quite often experienced, is named as chronic pain. So it should be very much noted that whenever you get to experience repetition of the pain signal at any part of your body, it could be headache, repeated one, it could be neck pain, stiffness of the neck, which doesn't allow you to move properly, and convenient in your day-to-day activities being disturbed, then do consider to seek the help. It can also be something in other joints, for example, the knee joint or the mobile joints, basically, the lower back, hip, or maybe even consider muscle pain. So you also be hearing these days conditions like fibromyalgia, arthritis. So many such complaints do come under this category, chronic pain, because they have some underlying concern with which the presentation of the pain is being observed by you. So do not neglect anytime you happen to receive the signal of pain very repeatedly and it's not resolving after a couple of weeks, then you should definitely seek the help. To get it diagnosed, from where it is coming, what's the reason behind it, and early you get to diagnose, you're much helping yourself to cure it, come out of this condition, and if otherwise, we'll go through getting to worsen this condition. You can see that when the pain is not going, it builds up the anxiety and the stress level keeps increasing. And because of that, your physical body also start to experience a lot of tension, like the muscle going for developing contracted, tensed out. And because of that, again, the mobility is being restricted and the very signal keeps on getting to irritate the nervous system and more intense anxiety be built in your system. It can also lead into depression many a times, lack of sleep, lack of sufficient appetite to be on set. And like I said, more of the neurophysiological reflex tends to be getting more and more deep-rooted in the body. So to an extent, let me tell you, people also get to be relatively ending up being so much depressed that they do not willingly stop themselves going out, meeting people, and that again definitely affects your social well-being. And obvious, the pain intensity many a times is quite making the metabolic sluggishness, which also gives in a platform for the deranged metabolism or the diseases connected to it. Like it could be impaired blood pressure, or it could be also affecting the hormones of the body, leading into thyroid abnormalities eventually, or even diabetes for that matter. So one note I would like to emphasize here is, early you detect, early to seek the help, you have more possibility to come out of this vicious cycle. And when you know the cause, then it becomes pretty easy to solve the problem. And do not seek any medications or picking up a pill, which seems to be easier these days, that you have an accessibility to pain relief medication. And it's pretty much agonizing to see that many would end up leading into a habituation of taking a pill quite often. Like, there is a headache dropping in and then you just find a simple pill to take off and then keep moving to execute your day-to-day activity. So it seems to be easy in the beginning days to solve the problem. Just a pill would solve your problem. But eventually you'll start noticing that the dosage doesn't work for you, the same pill you took rest, still the pain is not going. And it starts to get more and more deep-rooted in the system, and more chronic, more prolonged it is, then certainly it's going to be more trouble, and coming out of this vicious cycle will be very much troublesome. Okay, so the very symptoms, like we know already, we know which is not so like relatively common to be let go. So getting to be responsive, getting to be reporting to seek the medical help as early as possible is the first step from all responsible individuals, which is needed to come out of this condition. So now let's move on to the common causative factors, what can be relatively seen in many individuals that results into, that ends up into a presentation of pain as an entity. So here at this point, I would like to emphasize you on the importance of the posture. Like many of us, we know that the posture, what we are into to a big extent in most part of the day, can definitely induce a lot of impact on our muscles, bone, the spine, the
Shashirekha ji, can I interrupt for a second? Can you go to the full screen mode, please?
Okay. Yes, definitely.
The screen, yeah, full screen. Yeah, it's a little bit better. I saw some suggestions in the chat box also. If you can just go to the full screen.
Yeah.
Full screen.
Is it okay now? Is it okay now? Is it much visible?
Yeah, better. Yes.
Okay.
Yes. Thank you.
So coming back to the topic I was introducing you, that is about the importance of correcting your posture. This is one big way through which all of us can possibly prevent the onset of the degenerated related impact chronic pain in the body. Even the conditions onto the spine can be very much preventable by correcting the posture. So you have a picture over there, you can see the middle one is a good posture in which there is a midline drawn from head to toe. If you have a closer look at, you will see there is a small midline drawn from head, the center of the head, which we call it as the crown area. From there, the line is dropping, dividing the body exactly into halves, equal halves, and finally getting to close at the arch of the feet. In this way, if your posture is right into this equilibrium, you will see that none of your joints are overburdened with your weight. The same weight is very well distributed equally on to all the joints, and none of them are overloaded with the same weight. But on the other two pictures, if you look on, okay, if you take a look on the other next beside pictures, a person is being seen with a kyphotic spine. Kyphotic means where you round off your shoulder and then stand leaning onto the front. So in this pose, you will see the weight now is not distributed in the way it was in the ideal picture, the middle one. Instead, here, the lower back is overburdened. The knee joint is also overburdened. And this makes a person over a period of years, get susceptible to develop wear and tear at this particular joints and eventually develop pain. In the beginning days, it will be mild to moderate, and eventually, because the bone of the spine now getting narrowed, compresses the nerve and the neurological pain, the nerve compression pain, what we call it as sciatica. You would have heard of spondylitis, spondylosis. There are several names to describe this chronic condition, be made to develop. So imagine you are taking care of your posture, helping your muscles on the spine get stronger so that you are keeping up the posture pretty good in most part of your day, especially at your work where you tend to spend maybe a couple of extra hours, like 4 or 5 hours continuous, being seated, being standing. If the posture is rightly made correct, then we do avoid the impact stress falling onto the joints and thereby help it not get degenerated, not get vulnerable to damage, the impact related to the compression be not further led onto the nerves at that junction. So prevention is one very much supporting element we do need to consistently take care about. Similarly, you do also see the third picture in which there is a sway back, which we call as lordosis. Lordosis means the person stands overarching his lower back. Most of the times we see that these people have weak abdominal muscles, and eventually even in the same way I described, the burden is going to be on the lower back, on the knees, and of course on the shoulder also. So pain related to shoulder and neck is something very much common in these individuals. And when the posture is going to be bad, imagine the muscle on that side becomes consistently contracted, and contracted muscles are short. They're not lengthened enough to accommodate the mobility. So you have to have a free mobile muscles to be finding a absolutely pain-free movement. If the muscle is contracted, then obvious that will hold you back, and there is a stiffness developed. Because of that stiffness, there is like stagnation of the blood flow, the lymphatic drainage, and even synovial secretion in other joints like the knee. The very synovial joints can also be affected. So in this way, the mobility gets to be far affected, and pain, of course, is a consistent companion. So consider correcting your posture as a priority. At whatever age you are, you could be in your 50s or 70s. Remember, muscle tissue is pretty adaptable. If you train it, if you go learn the way to stretch it, strengthen it. I'm also going to explain about how to make that possible in very simple way using some of the yoga postures. But at this point, like I was mentioning, at whatever age you are, remember, muscle is very much adaptable for getting trained to be flexible, to be strengthened, and to get toned also. Okay, never say that I'm old enough, now I can't do, or my muscles won't respond. You can very well make this listen to you, but every day working on it has to be made sure. So you have to decide first, let you know what's your postural tendency. Okay, you can always fit into these categories. Just observe, be frank enough to admit what your tendency is, and then help to get it corrected. So this is one very important step which needed to be known. Similarly, there is one more very commonly observed condition I would like to mention at this point. This is called scoliosis. The very scoliosis is the shift of the spine, as you can see in this picture, from the midline to the side. Well, again, you can see a lot of possibility that most people can tend to get to suffer from this condition? Well, some of people are born with scoliosis, but the incidences, what has been found out, birth scoliosis really is very, very less. But as a clinician, what we see, the number of scoliotic people reporting to us is developed over a period of time. Let me tell you how does it happen. Imagine you have your dominant side, like most of us are right-handed people, and we keep using the right side for everything, for day-to-day activity, to lift weight, to engage into skillful activities like writing, cooking, feeding yourself. So for everything, when we start using, in fact, overusing our dominant side versus the non-dominant side, that is the left side in a right-handed person, is absolutely not used at all. And the muscle now onto that side, to the left side, is relatively much contracted, relatively much less toned. Well, we can all observe that the strength in our dominant side is much higher than the non-dominant side. Similarly, the size of your finger ring onto the dominant and non-dominant side can also be pretty variable. It's a very element of note that the muscle strength, the muscle memory is pretty much well developed when it is more into usage. When not in usage, the toning fades down, the flexibility fades down, and that again is going to affect the mobility. And here in this very presented picture, you can see the hip is shifted. Okay, all the weight now is shifted onto the one side. And the shoulder is also tilted, making the weight fall onto one particular side. And what does really happen by this very scoliotic condition is that the wear and tear, the bones rubbing onto that affected side, is pretty higher, leading into degenerative change early to be visualized on that side. So the knee depletion, knee joint injuries, hip joint injuries, even neck pain onto that side is pretty possible just because of that tilt. And this tilt, or the very balancing of this scoliotic condition, is also very much possible. In fact, we do help people, we treat them using yoga as a therapy, where working onto the affected side, stretching will be indicated using some particular poses. And like I said, muscle being highly adaptable tissue, you can start to visualize the lengthening of the muscle on that side, the strengthening of the muscle on that side, so that the posture is very much corrected and the person starts to see a pain-free life in future. So these two important postural trouble, I want you all to have a look at yourself and do see if you fall into any of this category. Help yourself to correct this using the stretches, like I mentioned to you. Postures of yoga are highly beneficial, and being aware of your posture, being aware of your tendency, that makes you overcome this condition. Okay, so that's a very briefed up information on the posture and postural imbalances. At this point of time, I would like to see if there is any questions from the audience to be answered, and then we'll move on to the other information. Chrissy, do you see any questions?
No questions in the chat right now. If you do have questions, you could go ahead and raise your hand or type in the chat. You can use the reaction buttons at the bottom to click raise hand.
May I go ahead and ask?
Yes.
All right.
Oh, so were you suggesting in these situations there is no Ayurvedic solution, but more of yoga, altering the
Well,
posture?
yeah, Ayurvedic solutions I'm going to brief up on gets to use some herbs which are purely anti-inflammatory, analgesic, and again, the benefit of using them is because most of them have a biocomponent of supplementing more of this nutritional support for us. Like we have herbs like turmeric, aloe vera. I'm going to explain about that also in future. So using them, the help of relieving pain and even treatment protocols like deep tissue massage, steaming, okay? You can see the muscle tension on that part will be relieved by the techniques of deep tissue massage, which helps to drain out the lymphatic secretion from that area, increase the blood circulation, and with which the heat is liberated. The heat makes the very tissue respond to the contraction and relaxation. So thereby the very result of relaxing the muscle and pain relief is achieved.
It's a combination. Okay, got it.
Yeah, definitely.
More.
Okay,
Yeah.
shall we move on then, Chrissy?
Yep, doesn't look like we have any more questions. Go ahead.
Okay, fine. So at this point of time, I would like to introduce the very different elements we can support to avoid the development of pain in the back in particularly, because most in concern we have the chronic pain issue coming in the back. Like I said, it could be upper back, lower back, or in the neck, on the upper shoulder, anywhere. So there are some very common elements people can take into consideration. That is to help the posture very well corrected, as we spoke about it already. Learn to sit well, because most part of the day will spend be seated, and you should see that there is a natural curve in the spine and that need to be well supported. I mean, of course, if you have a stronger muscles, there will be absolutely no problem in holding a upright posture. But if you don't have, train yourself, and by the same time, use a good chair to be seated. What I mean by a good chair is, your office may not offer you the right chair to fit your height of your body, height of your spine. What I mean is, sometimes you see that some of the chairs doesn't give you a good handrest, the handrest which is required for your height. So some of the handrest will make you have a shrugged shoulder like that because it is elevated. Some of the handrest will be so down that you would be literally getting to slouch yourself to rest on them. And some of the chairs doesn't come with the handrest at all. So thereby you would be again comfort seeking to either lean on to your left side or to the right side. Okay, so do look on to the height of your spine, help get supported with the correct positioning. Similarly, whenever you are bending forward, you should always see that you do learn to bend from the lower back and do not overstress. So rather, you could see that the very extension or elongation of the spine being taken up. So don't round off your shoulder, rather bend from your lower back, like arching, like an extension. Similarly, never force the spine. This is especially for all those people being over enthusiastic to start doing any physical activity or even taking up yoga practice. They would kind of force themselves to do a forward bend. So this can be pretty much very dangerous, because it can very much affect the spine disc and eventually come up with some of the disc injuries. So do help yourself with them. And at this point of time, there are some basic stretches, the simple to do at your desk, right next to your office desk, whenever you get up to have a cup of water or get up to visit to washroom in every second hour or so, just do a simple, these stretches of the spine. As you can see, the first one is a standing extension of the spine and a very slow forward stretch. Similarly, simple twist, standing twist, and a side bend also. So the reason the stretches are going to be pretty helpful and prevent the possibility of pain in the back, because they are going to elongate the distance between the bones of the spine and relieve the congestion onto the disc and help you prevent the possibility of the disc injuries in future. So this is about some commonly noted pain, the cause, and the way to prevent it. Now, let's move on to know about the other common pain elements, like which come from infection or inflammation, post-injury. We have several conditions like arthritis, which is like, inflammation of the joint. There are reasons for it, like it could be either degenerative one like osteoarthritis, or the infection related one, what we call it as rheumatoid arthritis. So like I said, to differentiate between them, you have to get the help of a physician. So do not neglect, visit, get to know what it is. The other condition also noted could be either the sciatica, or it could be fibromyalgia, much of other different types of pain elements need to be first diagnosed, and then the treatment planning becomes much easier. So to introduce you now to the approach in Ayurveda, firstly, I would like to explain about what Ayurveda is. I know many of you know what is Ayurveda. In a simple way, it is nothing but a life science. The science which helps you moderate and get the best help from the lifestyle management only. So, like I just started talking to you about the importance of posture, it's going to be even more important to see what we eat, how do we take care of ourselves in different climatic conditions, okay? Similarly, the very elements of body energy, if it is disturbed, then also it can lead into the presentation of the pain. So the very way through Ayurveda we are managing this chronic pain, firstly, is by taking the help of the treatments, particularly which gets to relieve the stress and anxiety. So you would have heard or seen or experienced such treatment options. The very commonly used one is called the Shirodhara, which is a quick support we take from to attend to the psychological as well as the physical complaints. So all it does is brings in a quick relaxation and makes the mind and body get to resolve the very intensity of the pain and the response towards the pain onto the physical body. So the treatment is offered using some herbal medicated oil onto the forehead, and the stream of the oil, the lukewarm oil, keeps falling over the forehead, and the person receiving it is asked to concentrate on it. So what it does is the very relaxation, toning up the nervous system, and like I said, an absolute stress relief. So this is truly beneficial for those who are suffering from chronic pain and associated symptoms like anxiety, depression, sleeplessness, okay? So the treatment be asked to be taken for about a week to 2 weeks of time in different intervals. The physician will decide that. The other commonly used treatment protocol is using the paulites, which is a very herbs tied in a cloth, and that is warmed up, and using that heat, the massage is done on the affected body part. And the response of the muscle in chronic pain is that it will be pretty contracted. The tightness in the muscle is very much making the mobility restricted. So when we ask people to start moving, pain doesn't allow them to move. And unless they move, unless they stretch, the muscle is not getting flexible and the mobility is not helped. So it's like a vicious circle now. To break this vicious circle, the very treatment option like this is very useful. So the heat, what it does is, it's going to resolve the contraction, increase the blood flow, help the lymphatic drainage. And in joints like the knee, the shoulder, the hip, the synovial liquid is also being pretty well mobilized. All of this together will take a good part in emphasizing mobility betterment. So obvious that when this treatment is adopted with the yoga practice, simple to do stretches, we're obvious to see a good result in chronic pain management. The other one very commonly used is overall body steaming. This is called Svedana. Multiple different joints sometimes will be involved, or multiple group of muscles will be pretty much made inactive because of mobility. So taking a steam is highly beneficial, and the steam offered will be herbal again. So some herbs are infused, boiled, and the steam coming out of it is used over here. Okay, so aroma of the herbs as well as the active ingredient phenols present in the herbs make the deep penetration into the skin and the muscle, increase the blood flow, increase the lymphatic drainage, and similarly helps the secretion of synovial, and that way it emphasizes on mobility. So if you do not have easy accessibility to Svedana or the steam, you can also at home manage to take some local steam. There are several ways you can use it, like dip a towel in hot water and then put it on the affected area, or take a hot shower and then cover yourself with a blanket, allow yourself to sweat for a while, 5 to 8 minutes, and you can find a big difference in your mobility. So self-care, like I said, in Ayurveda clinics, we take a lot of time to educate people about this different ways of managing their problem. Once they are better educated, they are better to deal with their food choices, the mobility training, and simple ways to be taken care at home. So with a couple of visits, when you meet the doctor, you will see each visit you will start getting more and more better information about your condition, and you become more better to help heal yourself. So this is about the one more strong therapy called Svedana. And of course, you all know about the herbs. Many of you would have also started using it. Some of them are there in the kitchen, and you can see that the commonly used aloe vera in many different skin conditions let you know it is one best anti-inflammatory and analgesic. Aloe vera is a wonder herb. It constitutes about more than 200 biocomponents, and some of them are calcium, iron, potassium, magnesium, and the most important, it's rich source of vitamin A, C, E, and B. B1, B6, and rarely available in vegetarian source. Even B12 is rightly available in aloe vera. So this B12 component as a nutrient support is extremely beneficial to recover and heal you up from the neurological related chronic pain. So the physician will decide which herb goes good with what requirement. Okay, like you would have seen that upon taking such supplements, some people get benefited, whereas some do not. The reason is your complaint may not be neurological, so it has not resolved. So it makes a better sense to take a physician expert advice and let them pick you up what is that required herb for you. And this aloe vera, like I am speaking about, taken internally on a good dosage. Again, the dosage should depend upon the body weight of the person and the intensity of the presenting complaint, what he has been going through. So within 3 days, you will start observing a much better improvement in your pain intensity and mobility. So this is one herb. Similarly, we have several other herbs like turmeric. It's also one most used, most known Ayurvedic herb. And the anti-inflammatory benefit and the very analgesic benefit, you should be knowing how to handle it, because turmeric is a strong herb. We also use it as a spice. In a big dosage, it is acidic also. Unlike aloe vera is an alkaline. It's an extremely cooling herb. This herb is pretty high, is like a strong one, tend to create acidity. So depending upon, again, the requirement, in different formulation, it is given. One commonly used formulation I would like to mention here, because this way you can safely use turmeric, and the way it is indicated to be used is with milk. Again, milk, I emphasize here to use any vegetable milk. It could be either almond or maybe even coconut milk or millet-based milk, because again, to consider not to worsen by choosing harmonized cow milk. So this turmeric, ranging from 1/4 of a teaspoon to 1/2 a teaspoon in a glass of warm milk, taken once a day, twice a day, is an extremely beneficial way to give anti-inflammatory and analgesic benefit. Similarly, there are several other herbs to mention, like you have gugulu compositions, most trusted pain relief components we have in Ayurveda, and also the nerve relaxing herbs like Brahmi, Jatamamsi. They all can be much used in combination or alone. Again, your physician will decide that. So one point I would like to emphasize here, that do not go self-experimenting by choosing herbs. Many people think that herbs are extremely safe to be used. I can simply choose my self and then start taking, let me see what happens and how better I do to get to find myself relieved. Like I mentioned, there can be very specific requirement. So do make sure you talk to your physician, Ayurvedic physician, let them decide you, and then just keep it continued, and you will see very much betterment of your condition. So with all of these different treatment protocols, we do definitely add the mobility help from yoga. Here you can see some basic poses, very much easy to be done and very much easy to be learned over a period of couple of weeks. And the way they are going to be helping improvise your flexibility as well as the mobility concern, pain-free concern, is because they're all isometric stretches, and the isometric stretches are greatly helpful in increasing the length of the muscle. And with the flexibility in the muscle, the mobility is very much increased. So start up with a daily routine practice and definitely get to see a nearby yoga place to go and practice, because in the beginning days, you will need a person, an instructor to help you accommodate into the right alignment. After a couple of months being with a trainer, you will be okay to manage your own self. And you will be definitely taking time to meet people. That's one more way you can encourage yourself to make up a daily routine. And obvious, the social togetherness is also a much big helping hand in managing and recovering from chronic pain. So these are the simple most information from the Ayurvedic science which I meant to offer in this webinar. I hope the things are pretty much conveyed, and the very related help we also take time to offer is using relaxation techniques, guided meditation and relaxation. And you see that a self time, a silence time taken on a daily basis is something much more rewarding than just a relaxation. So adopt into a lifestyle, take changeovers, a lifestyle change to better manage the condition, and I'm sure you will start to find a much effective result, and the relief from chronic pain is definite to happen. Well, let me know if you have any questions, any more details from the side.
Can I start?
Yes, yeah.
Okay. I'm glad you made the point about, see, a lot of the Indian, we live here in the Houston area, there are a lot of Indian grocery stores, and they sell all these different herbs, Triphala and ashwagandha and all kinds of things, and people are just willy-nilly using them. I'm glad you made that point, that wouldn't it be better to get a Ayurvedic consultation first, kind of know your Prakriti and what combinations of these herbs are appropriate in situations, and in which situations they are not appropriate?
Yes, that's definitely required thing, because otherwise, like I mentioned to you, just the same example, turmeric, if you do not know and you are already Pitta, which you might know what it is. Pitta is like the acidic body type. So being acidic body type, if you consume turmeric 2 times a day, 3 times a day in that big dosage, you will end up creating more hyperacidity in the body, and thereby also disturb the absorption power in the gut. So it is very much required to identify the particular constitution and relatively choose what herbs works good for whom. Then only you will start to see the better control and the solution for the problem.
Excuse me, I also have a question similar to that. Today I went to HEB and I saw so many bottles of this ashwagandha. What is this ashwagandha being sold, in capsule form and tablets and so many bottles? What is that?
It is in fact a root herb, extremely beneficial as a stress relaxant, even nervous system tonic. Okay. And at this point, I would like to mention that the herb ashwagandha is pretty heavy to digest. Okay. You would have heard or seen while you consume some of the medications or will consume some of the food also, treated with different combinations of spices. Some of them you will feel light after eating. Some of them you will feel pretty heavy after eating a particular different combination of the food and the herbs. So this one, particularly ashwagandha, being heavy to digest, the time taken for completion of the digestion can vary from person to person. So many a times, if people having poor digestion, those digestion is already bad, they are not able to take the complete usage of this herb because they find it often indigested and the sluggishness in the bowel movement also. So for the same requirement of nervine tonic, in such individuals, Brahmi is more preferred as a choice. Brahmi is one best nervine, memory booster, relaxant. And Brahmi is also given to children, because it's pretty easy to be digested. In a small dosage also, it works to be pretty strong as a nervine tonic. So that's a better choice for those people.
Oh, Brahmi is better than ashwagandha, you mean?
If you do not have a strong digestion, then opt for Brahmi.
Okay. I've taken Brahmi before, but I was a little bit confused. I was looking for Brahmi and then, I didn't find that. And I took this herb called Bacopa. What is that, Bacopa?
Bacopa moneri is the Brahmi itself.
It's a substitute?
It is. It is Brahmi itself.
Is it addictive?
No, not really.
Nikki has a question.
Okay.
I have a question.
I have a question too.
Yeah.
Can I ask?
Yes.
This is Venugopal from Houston. I have, last few years, I'm having ankle pain in both feet. So I have seen podiatrist and he said probably there might be some cartilage damage in the ankle. And we got the CAT scan or MRI, I don't know, I forgot. So he suggests, he just gave steroid injection. Other than that, I'm not taking any medicine right now. I don't feel the pain that much, but when I walk for like half an hour or more, or when I'm playing tennis, after I finish playing the tennis, I feel pain for about an hour or so. So do you suggest any medicine for that? Ayurvedic medicine?
Well, of course, taking the help of Ayurvedic medicine should be decided looking onto the joint condition. I would like to say that if you observe any swelling on the joint, then you would require anti-inflammatory stuff. Okay. Otherwise, any simple analgesic like pain relief support from Gugulu components are highly beneficial. So it'll be wise enough if you do send the report of the MRI or meet in person where we can check up the very presentation of the problem, see if it is swollen or not, and then it would be wise enough to pick up what medicine works good for you. Till then, take care of your movement support, like always wear a good supporting footwear, which has some small cushiony benefit onto your heels, so that your body weight when you're moving, because of the hardness of the ground, should not over impinge and cause more of the impact stress. So select some good footwear which does offer this help for you, and you will find much better relief.
Okay. Thank you.
I have a question.
Okay.
Rekha,
Yeah.
okay.
Hello. I have a couple of questions. One is that how would you differentiate organic pain from a functional pain? Sometimes you try everything and nothing works. And organically, you don't find.
Differentiation is going to be simple. We do clinical examination. Like I said, swelling can be one possible symptom if there is something deep inside being inflamed or being into active state of inflammation, infection, or it could be a relative wear and tear. So with physical examination, clinical examination, we'll just take the kind of conclusion. Similarly, we'll also consider the like body balance features, like if the weight distribution has been more onto whichever side of the body, and then the rule out can be done. If still in question, if still in doubt, then we also take the help of X-ray, MRI scan to rule out anything wrong underneath.
And if there is nothing on the MRI,
Okay, in that case, definitely neurophysiological relaxation has to be offered. And I'm sure in such condition, the techniques like guided relaxation, meditation, some silence practice also will guide you, some writing therapy, as well as the mobility training help, like self-massage, also self-stretches to be offered on a weekly basis, followed after when you start moving and particular postures are daily practiced, you'll get rid of that pain.
okay, good. And the other thing is you mentioned about aloe vera.
Yeah.
Is that to be taken orally or applied locally?
If there is like, pricking, throbbing type of pain, application is very much to be considered. If otherwise like a deep impinging pain, etc., then internally also be insisted, because I told you B vitamin, which is pretty much good percentage available in aloe vera, is a good support to relieve the neurological related pain. The nerve impingement related pain is well relieved with aloe vera internally while taken
Internal,
internally.
what's the
Dosage?
What is it called?
Well, again, if you are weighing about 60 kilos, something like that, you can go with 3 times a day dosage. And fresh aloe vera, if you're accessible to, then do scoop out the jelly portion from the very
Right.
side inside, and then have about 3 teaspoon, 2 to 3 times a day.
Just as such, swallow that?
Yes. Yeah, you can just eat that, followed after with some warm water.
Okay. Okay. Thank you.
As it's a good source of this B component vitamin, it does soothe out the nervous system and brings in a quick, inflammation relief.
Relief. And anything which helps with the cramps in the legs?
Good. A quick source of any potassium, magnesium, consistently given for at least 3 weeks is finding a good relief for you.
And which that would be in Ayurveda would be what supplement or micronutrient?
Like I said, even aloe vera has a good portion of potassium, magnesium, or otherwise you can also choose from food components like several different nuts do have magnesium, potassium. Even as simple as banana is a good source of potassium for you.
Right. Okay.
Okay, Nikki has a question.
That's the other thing that I was going to ask. I'm sorry.
Wow.
Can you hear me?
Yes.
I don't know how to unmute my phone. Is it unmuted? Can you hear?
Yeah. I can hear you.
Okay. So the aloe vera, that's what I wanted to ask. So it is kind of gooey and kind of gross, right? To eat just like straight from the plant like that. So
Jelly.
right?
It looks like jelly.
So so what is any other suggestions? Just so we said 3 teaspoons and with
Yes.
warm water.
Yeah, just eat that
after, right?
and just warm water.
And you swallow like covering your nose, that kind of thing.
No, it's not that bad. It's like a jelly. Let me tell you, many people would like to blend it in their smoothie, etc. But for such concern, like if the pain concern, if you want to relieve with aloe vera, it's always better to take it separately. Don't mix it with any other ingredients.
Okay. Uma is
But
asking
it's good. It's good for the stomach, right? It's good for the stomach also, right? For
Yes. It is one good, wonder herb, you can say.
Yeah,
Many
I have a
eat.
question.
Yeah.
I mean, HEB has an aloe vera juice available. Can we take that, or do we need to make it fresh?
If you have an accessibility for the fresh one, always prefer it. Because anyway, when you want to preserve it, it would have altered, right? And B vitamin, let you know, It comes under water-soluble vitamin, highly unstable. Okay, more you process it, you're going to fade down the percentage of it.
Same thing like when I'm
Any kind of aloe vera, particular kind of aloe vera.
Yes, yeah. Okay, there is a question called any type of aloe vera or a particular one. Okay, what I do indicate is the fresh one. Okay, any other type, the small, big, little darker or little lighter, all of it is fine.
Okay, Nikki has a question.
Okay.
Is there any Ayurvedic
I have a
approach
quick
to
question.
pathogens? The strep, ABC, staph, Epstein Barr, etc. Nikki.
Okay. Was there any other question? I heard a gentleman.
I have a question, quick question, hopefully.
Okay.
I remember my mother giving me Brahmi when I was a kid 70 years ago.
Mm.
And she would take to the next available Ayurvedic place and they will give me Brahmi tablets and 2-3 days I'm done. That's what I remember. But my question is that what is the safe length of the duration you can give for the kids particularly?
For the kids, if you're looking for helping them better concentrate, improvement of the memory power, for all those definitive nervous system tonic benefit, it's preferable to use it as a food supplementation at least a couple of times in a week. So you can consider to use it in your, let's say, pancake. Okay, that's the best way to use it as it fades down the slight bitter taste of it. Otherwise, children find it hard to gulp it down. So just chop down fresh leaves, chop it into small pieces and add it to your pancake, like dosa kind of a consistency. Okay, or
It can be
else
taken indefinitely.
Can be taken.
Can be very
6
long time.
months, 1 year.
Yeah, definitely. Like I said, couple of times in a week, do it as a food supplement.
Okay, Nikki has a question.
Yeah. There's one more question from Nikki, that is there an Ayurvedic approach for detoxing pathogens? Definitely yes. Again, it depends on whether it is in the joint area or if the problem is there in the gut. Okay. So relatively, the detox procedures called Panchakarma, wherein which the gut detox from purgative method is executed, and in other ways the very detox process in simple way can also be picked up as fasting with some liquids will be advised to you. Again, like I said, it'll be pretty much individual to note what works good with that person. So in such requirement, we'll also in such
somebody has to mute.
yeah. Okay, so in such requirements, we'll advise you to go through liquid fasting for 3 days to 1 week period using different liquids, and that's the way you can get rid of the pathogens from the body. Okay.
Glorious.
There's another question called, do you have any herbal recommendations for diagnosed rheumatoid arthritis? Yes, definitely. The very disease-causing organism, focusing on that, the combination of herbs, like I mentioned to you, gugulu combinations are highly effective. Similarly, there's one more called decoction-based herbs. Okay, so both of them taken for at least 3 to 4 weeks of time in a good dosage will resolve the inflammatory changes in rheumatoid arthritis. Okay, any other questions?
I have a follow-up question for my ankle pain. So, is there any cure for like a cartilage damage in the ankles?
Well, let you know, cartilages do not grow back. Okay, connective tissues, particularly tendons, ligaments, cartilages, they don't grow back. So that's the sad part about it. So the best remedy we can choose in such condition is that the muscle around the joint needed to be made stronger so that the impact falling onto the joint is relieved. So on that way, you can manage to see pain-free mobility and still make your day-to-day activities be made easier, and still with the cartilage damage, you can have a good mobility.
For diabetes, what do you recommend? Like, I was wondering if people are taking Karela.
Well, again, the usage of the herbal combinations in individual case, depending upon how impaired their blood glucose level is. And alone Karela won't do anything without bringing up the lifestyle changeover. So definitely a lot of better lifestyle changes, along with good education about what foods with different GI index be there in their food plate. Only when all of these things are introduced together, they can find a better control of it. Otherwise, just popping up a Karela pill would definitely don't do anything.
What about that sugar substitute? Instead of sugar, they put the
stevia.
Stevia.
Okay. Well, usage of stevia, I still advise people to limit it because, your nerve, your brain remembers that taste and the pleasure involved in that taste. So more and more you will start enjoying the calorie in that food prepared with that stevia. You don't just add stevia, you have a cup of like coffee with stevia. So coffee has many other ingredients, right? So if at all you offered yourself like 1 or 2 cups every day, that still adds on a big portion of calorie as well as that caffeine. But if your body is not really tolerating that caffeine, then it's an absolute, trouble-inducing situation. Same goes with the sweet made out of stevia also. So better you enjoy the natural, taste in different food ingredients, start to learn the very different ways to help you satiety. Your taste buds will slowly get to adopt to those changes. So whatever different change you do in your diet, wait for a few weeks so that your body gets adopted and you will start liking it. Okay, don't fall into some quick alternatives.
Okay, but is there anything else other than stevia which you recommend?
Well, if a person is diabetic, then it's an absolute no. Okay, but if there is like a borderline tendency, or maybe they're cautious about their calorie intake, then try eat fruits in between so that you satisfy your sweet craving. Okay, 1 or 2 different fruit in a day will still add on extra vitamins in your diet, as well as find out new different like a healthier options like dates it could be, so that you tend to satisfy your sweet craving and not getting more on to the calorie uptake.
Okay, thank you so much.
Okay, Evelyn has a question.
Well, there is one more question called, can you cut out the aloe vera and store the leftover in the refrigerator in a container? Or what is the best way to store the gel after it's all cut out of the plant? It's a good thing to note that you're not cutting out the entire thing. Have just small portions, like, just start to open up, scoop out, just close the other part and store it in a container. And then next day, just peel out some more sections, scoop out, and then close it, and then make the usage of it. In this way, you're absolutely safe to use it. Don't scoop out everything. You will start noticing that the color changes. The oxidation process starts, the nutrient in it starts to fade down. So let it be secure in its natural covering. Scoop it out, repeat, pack it as it was before.
I have a question.
Yeah.
What is the role of intermittent fasting? There's so much of hype about it these days. Does it have a place in Ayurveda or in the control of diabetes?
Very much yes, because in traditional way, what we were doing, like, stop eating after sunset, start your first food of the day only after your morning first routine to start with is Surya Namaskar, followed after Surya Namaskar, you take a shower, offer prayer, and then your first food of the day. So in that go, you already have more than 10 hours of gap from the last dinner to the next day breakfast, which is nothing but an intermittent fasting. So it's highly recommendable.
वो चेंज करना पड़ेगा सुबह का जो हम 7 बजे लेते हैं.
Can you
Okay.
briefly tell us, very briefly, if you can, what is the Panchkriti consist of? Panchkarma consist of?
Okay, that's good. Panchakarma is 5 different modalities of detox process in Ayurveda. The usage of them again be individualized depending upon the disease, depending upon the body condition or the dosha of the person. We choose one among those 5 or couple of among those 5s. So the first one called emesis treatment. Okay, you're given some medicine and you're made to vomit. So this way, the content of histamine, the biological, pathogens, the toxins come out from the upper tract. The second one is called Virechan. In Virechana, the cleanse of the gut is done. And this is a method where we induce the colon cleansing, like a purgation. So some medicine is given that makes you to visit your washroom 8-10 times in a row and offers a thorough colon cleansing, gut cleansing. The other therapies in Panchakarma is called Basti, that is enema, offering enema as a treatment protocol. The other one is called Nasya, which is offering nasal drops to both the nostrils. Again, nose is the gateway to the brain, and relatively the very problems, like it could be migraine or it could be spondylitis. Okay, as a nervine tonic also, the nasal drops are offered. And then there's one more called bloodletting therapy. Blood from the affected deceased site is being let go. So there are several different instruments used to do this procedure, as simple as taking out the blood from the veins through syringe or using leech therapy, scraping the affected skin part, like that the different modalities are used. So all of those are pancha, that is 5 different therapy in Ayurveda.
Thank you.
Does one have to do panchakarma if they have no health problems? Does that
Well,
mean anything? Okay.
Yes. Let me tell you why in these days the detox is necessary for all of us. May not be panchakarma, but a simple detox like a purgation, a simple purgation for about 3 days is going to be necessary, because in many different ways we end up getting affected on our metabolism, like the stress involved, and gut is said to be the second brain. So whatever goes in there, the effect is there on your digestive system. Eventually, even aging has got an effect on digestion system. Plus, the food components we are eating today may also contribute a lot of toxins be deposited in the body. So to let them go, we can choose a quick home detox, or it could be guided fasting therapy. And by opting to these choices, a healthy person can very well prevent the possibility of any problems in future, connected with the metabolism and give a quick start for the metabolism to be well managed. So that's how once a year you can recharge your system.
So that's like a abbreviated version of the Panchakarma as a prevention for future problems.
Yes.
Okay.
Does
What
it
is that
mean?
called again? What is that called again?
Which one?
What you just described.
It's called
Home detox.
Home
Simple.
detox or fasting therapy, liquid fasting.
And does this may affect the probiotics in the gut?
Yeah, definitely. Because when you do have a quick cleanse, you will see that the very discharge of pathogens, the discharge of these biocomponents called urea, uric acid, histamine be released out of the system. And you will see that the absorption capacity in the gut is given a quick recharge.
What is home detox again?
A home detox is a simple procedure to clear off the toxins from the metabolism. Again, it has to be guided by a physician depending upon your individual body type and the requirement. The choice to use simple combination of herbs taken for about 3 days and a quick detox be manageable.
Do they sell any packet like that? Home detox.
Of course, you can find so many, but like I said, you have to see if that matches to your body constitution, or else maybe you can have more dosage than you require and end up having more episodes of diarrhea at home, which will be not so manageable easily on yourself. So it'll be wise enough to first talk to the physician and then choose the combination and the right dosage for you.
Sounds good.
Okay, I think we're all good. We'll see.
Okay. Any more questions?
Thank you very much. Had a good.
Fantastic presentation.
Very nice.
Okay. Thank you, everyone. I'm glad to see you all guys being
Informative.
enthusiastic. Okay. See you then. Take care.
Thank you.
Thank you.
Thank you.
Not a bun crow screen. Leave me.
Thank you so much.
Thank you.
Thank you, Dr. Shashi.
What's your address in Houston?
We actually have 2 locations in Houston, one on Barker Cypress and one on Queenston. Would you like me to type it in the chat? I can do
Yes.
that. Okay.
Yeah.
Hold on.
What is the phone number to have access?
Okay, I can get that as well. Just a moment. Chat. Hey, Marley, I'm having a difficult time opening the chat. Let's see, but I can share screen. Can you see the VandeWellness website here?
Yes.
Okay. So up here at the top, the 1-888.
Ah, right.
Okay.
Mm-hmm.
And then our Katy location, or actually I can just scroll down the bottom here. Yes, Katy location 18510 Greenland.
Yeah, I did type down. I did type down, Chrissy.
I'm sorry?
I did type down in the chat box.
Okay, thanks.
Thank you. So what okay. Thank you, Pradeep. Thank you, Pratima. Thank you, Jayanti.
Thank you.
Okay, thank you. Bye-bye.
Bye. Bye.
Excuse me, just can you show the slide again, which had all those branches
Okay.
in India and here?
Okay. Who's that? Is it Jayanti? Is it Jayanti?
Yes.
Okay.
Thank you.
See, if you want to go for Panchagama retreat, you can go to Palm Coast, Florida.
Oh, really?
Okay, you can stay there, like, 7 nights, 8 days. We have one coming up on May 5th to 11th. Okay. Or if you like to do home detox, you can come to our center every day to get
Where
all
is
the
that?
therapies, and you can do it from home too.
Oh, the one in KT, yeah?
Yeah.
Oh, okay.
It's actually it's not in KT, it's Houston, but it's near to KT. There's a border of KT and Houston. So it's on Barker Cypress, north of I-10, just 2 miles north of I-10.
Oh.
Where do you live? Do you live in KT?
Clear Lake.
Clear Lake is how far it is from?
NASA.
Oh, NASA Pearland, is it? Okay. Okay.
Right.
Wait for a few more probably months. I think I can refer you something there.
Oh,
Or
wonderful.
what you can do is if you have some time, you could definitely go to Palm Coast. You can look at Palm Coast like locations there if you want to see there, right? So can you show the Palm Coast location, Chrissy?
Yes, I can.
Yeah, so see if you go in there, down there, yeah. This is a facility where you'll be staying. And, it's little expensive because we provide food, accommodation, therapies, doctor consultation for all 7 days, all yoga therapy, everything. So it's like, it's like 7 nights and 8 days you want to stay there.
Oh.
So we have an offer right now. It's 20% off. It's with the 20% off, it's going to come around $3,200 to you.
Oh.
Yeah.
Just like they have all these beautiful places in India, Ayurveda
Yeah,
places.
it is like that though. Yeah, it is like that.
Very scenic and.
Exactly. Okay. Thank you,
What's
Jay. So if you're,
your name? What is your phone number?
yeah, you can call 386-868-0666. That's the number. 1-888-826-3329.
What's your name?
My name is Murali.
Oh, okay. Nice talking to you.
Thank you. Thank you, Jayanti.
Yeah.
You have a great day, and please, keep in touch, or subscribe to our email list to get some discounts, something like that though, or get to know what kind of events going on.
Right.
Okay.
Yeah, you can also download the e-brochure if you go to the VandeWellness website at the top right there that I'm showing you.
Yeah.
Okay.
Okay.
And that will list all the services.
Okay.
Okay.
Thank you.
Thank you. You have a great day.
Yeah,
Great
very
evening. Great evening. Good night to you.
Yeah, thank you so
Thank
much.
you.
Thank you. Thank you, Pradeep. I think he forgot. Okay, thank you.